findings were changed. So what could be the reason? Like when the bilirubin is high, what could be the reason for a normal HGOT and HGPT? As we all are aware, there is one B complex vitamin which is called vitamin B6 or pyridoxal phosphate, which is a cofactor for formation of HGOT or HGPT or ALT or AST. And we know the alcoholic patients having lack that enzyme or they are deficient in that enzyme. So what happened in this patient, as this is a coenzyme to form HGOT and HGPT, you will this patient will have high bilirubin but normal or low HGOT and HGPT. But whenever at the time of admission, but clinician because they knew this patient are having low level of vitamin B12 vitamin B deficient, they will give them B complex injection, which provide a pyridoxine to this. So after a day or next day, we will have this higher values of HGOT and HGPT with the bilirubin. So clinician will ask, no, look, like yesterday we sent the sample, your HGOT, HGPT was normal, but today it has come to, it is higher. Nothing to worry because the clinician has administered the patient B complex injection, which contain pyridoxine, which is a cofactor or coenzymes for these things. So that's why your values are increased. So you are absolutely fine in that thing. Okay. So now another case, like I followed this case for a longer period of time. What happens, as you all aware that HGPT or LT is a cytosolic enzyme and HGOT is 20% cytosolic and cytoplasmic and 80% is mitochondrial. What happens whenever there is long term, initially the cytoplasm will get damaged, which release the HGPT in the circulation. That's why we'll have a high values of HGPT. But as the progress, the mitochondrial damage starts in, which leads to the higher value of HGOT. So, so what happens? Higher value of HGOT, and once then what happened next? Then this is the when the necrosis sets in, as the cytoplasm mitochondrial both are damaged, you will have low value or normal values, low values of both these HGPT and HGOT with low or high bilirubins. So this is nothing like these things. Like this, by this we can actually guide a clinician what is happening to the patient. As you know, the cirrhosis is a step by step. But first there is cytoplasmic damage, then mitochondria damage, and the necrosis are sets in, which leads to the cirrhosis. So these are the stages. If you find meticulously, we can find out and give the clinician exact the diagnosis, and we can guide the clinicians. So this is the take home message. Don't worry if you are having normal or low values of HGOT, HGPT with high bilirubin in an alcoholic patient, or the values are fluctuating. This can help you in correlating the things. So the second case was a 32-year-old pregnant term paid lady with a high level of alkaline phosphatase. Actually, this case was when I was supposed to leave the lab. The technician came, sir, a term lady has got a high value, like it was 2,250 the ALP value. So she told me, sir, what could be done? But I was thick. As you know, this alkaline phosphatase is a placental form of alkaline phosphatase is there, which is increased. Normally, a pregnancy will have high value of alkaline phosphatase, but don't but it won't be that. It would be like 5 to 10 times, five times higher. But this is a classical case where you get 20 times more than 20 times higher values of ALP. So what could be the reason? So this patient was having a placental insufficiency, and what happened? The syncytotrophoblast of the placenta will release the alkaline phosphatase. When it is get damaged or there is something like a placental disruption, this alkaline phosphatase will increase. Though 20 times more increase in value of alkaline phosphatase, at terms indicates there is placental insufficiency, which might lead to IUGR or preterm labor. So technically we should guide our, we should inform our clinician or gynecologist regarding these things. As usual, I informed these things, and baby was delivered, and it was IUGR baby. And next, after 2 days, alkaline phosphatase were normal. So thanks a lot. And this all is like I would want to share about this. Thank you for listening me patiently. And this is all about like those two cases. कितना हुआ? Hello, hello. अरे 6 मिनट हुआ?
हाँ,
जल्दी हुआ कि कम?
it was 6 minutes.
6 मिनिट हुआ सर आप.
6 मिनिट मध्ये झालं ना? ओके. काही सजेशन मॅडम?
तुम्ही लॅब मध्ये येऊ शकता का? आपण लॅब मध्ये थोडं मॉडिफाय करू.
चालेल, मी येतो ना. येतो 5-10 मिनिटात पोहोचतो मी तिथे.
ठीक आहे. आणि तुम्ही जे कोणते तुम्ही रेफरन्सेस काढलेले आहेत ते पण घेऊन याल.
हो मॅडम, मी रेफरन्सेस मला म्हणजे मी ते टाकले नव्हते, कारण मी ते याच्यात मला हे केलं. तुम्ही बघून घेतो मग नेटवर्क टच
इथे
करावं.
आल्यावर बोलू.
हा चालेल चालेल मॅडम,
तुम्ही
चालेल
रेफरन्सेस
चालेल मॅडम. ठीक आहे मॅडम.
तुम्ही
हॅलो मॅम. हा येतो मी, येतो.
या.
हो.